Okay, Vice Chair.
Are you ready?
Yes.
Good evening. I would like to welcome everyone to the May meeting of the Pitt County Board of Health. At this time, we will call the meeting to order with roll call provided by Mrs. Betsy Wallace.
Adam Harrell. Tina Dignan.
Present.
Martha Engelke.
Present.
Rex Fleming.
Present.
Herbert Garrison.
Present.
Mark Hayes.
Present.
Scott McIntosh.
Present.
Latish Hadidar. Kelly Pack Smith. Lowell Spate.
Here.
Alex Albright.
Present.
We have quorum.
Thank you, Mrs. Wallace. At this time, we would like to pause for public comments. Okay. There being none, I would like to move forward to the minutes from our April meeting. You should have received those in advance. Are there any edits or changes to the minutes?
Hey, this is Lowell.
Yes.
It shows me as present. I was not present at the meeting. I was late and got locked out.
Oh,
Oh,
thank
don't
you.
be late. Don't be late.
Thank you. Okay, we will make that correction. Are there any others? Okay, there being none with the correction of Mr. Spate's attendance, I would like to entertain a motion to approve the minutes.
Move to approve. I second it.
Thank you. Next, we would like to have the fiscal report provided by Marcia.
Hello, everybody. I hope you're doing well tonight. Carla, can we bring up the Board of Health fiscal report for April? Are you able to see that screen yet? No, me neither.
No.
Not yet.
Okay. All right, Carla. Oh, here we go. Okay, we are in period 10, which is we have 1 month left for our state funding, and this is closing out the month of April. We had a budget amendment, as you can see if you scroll down just a little bit. It was rather large, the biggest one I've seen. It is 1.447579. This is COVID funding. It is for regional response for vaccine. That money should roll over to the next fiscal year. We do have some ideas on how we're going to spend that money. We're going to be working with that with Dr. Silvernail and Dr. Hardy and Amy. I just wanted to point that out to you, although that was just added this past month. That brings our overall approved budget to $331,828. And as you move across your spreadsheet, our year to date, we're sitting okay considering COVID. Our clinics have been doing the mandated services. We expected to see less Medicaid dollars this year because of just the stress that we've all been under and the services we've been providing. Our clinic fees are just a little bit down. The state funding number looks rather large, but that takes in consideration the 1.4 that we just added. The county funding, we should receive that the end of the fiscal year, which will be the end of June. And as the other, although that is in the negative $70,000 will be reduced because it's double. One of our programs is supporting another position that's just in that line until the end of the year. But overall, the month of April, we did have a holiday, the Easter holiday, the Good Friday, and we are sitting okay with year to date at $663,000 when you take in the time and items. Do we have any questions? You're able to see that okay? If you scroll over, we can get the grant pulled up too. We've got a couple of our state grants that will be ending the end of May, our Triple P, our Positive Parenting Program. Carla, if we can get that, the grant report shared. Yes. You'll see that the Triple P has been spending down. We have the month of May, because that will end in the month of May, and then the HIV PrEP exposure program that will also be ending the end of May. We are expecting those two programs to restart as of June 1, but that will, you'll see those numbers July 1 when the county budget rolls over. We're sitting okay with all of our grants at the moment. And as far as positions, I'm happy to tell you at the moment, you did receive that in your email. We have 15 vacant positions as of yesterday. So there are all sorts of statuses. Some of them are being re-advertised. Some of them are being reference checked, but that's actually looking a little bit better. But that is all for the month of April at the moment.
Okay. Does anyone have any additional questions for Ms. Hall? Okay, if not, if we could have a motion to approve the fiscal report for May.
So move.
Second.
All right, thank you.
Welcome.
All right, can I get who was second on that? I didn't catch the voice.
That was Lowell.
Oh,
Thank you, Lowell.
all right.
Not a problem.
I just wanted to mention three things real quickly. Dr. Silver and I will be
Okay.
talking about the budget in his minutes. And we've also been training the reason why this was late yesterday to you, we have a new TARE system. Our TARE system is where you may be paid from another program, but your timing where you worked is, you have to account for where you work. So we are going live in the next payroll period. So next month, I'll have an up-to-date with some screenshots for you. We've simplified that. We're going from paper to electronic. So anytime we can do that, we're super excited. And we officially filed our Medicaid cost study for last fiscal year, last week. So that preliminary numbers are looking really good. So I'm looking forward to sharing that with you when that gets finalized.
Thank you so much.
You're welcome.
Thank you for
Thanks,
sharing
Cheryl.
that information.
Yes.
Do we have any items of old business since we received our agenda? No. Okay. I don't think there are any items of new business either. Is that correct? Okay, thank you. Now we will have the health director's report by Dr. Silvernail.
Evening, Madam Vice Chair. Good evening, Board of Health members. Give me a second to share my screen here. We know we worked you guys pretty hard last month, so we wanted to try to go easy on you tonight. Do have some important things to tell you about tonight. There we go. So happy May. Start out with some non-COVID issues or topics to begin with. Our budget, after negotiations with the county manager, he agreed to fund 6 of the 9 positions we had requested. He's funding 3 for environmental health and 3 for personal health. We had requested 3 more for personal health. We have a number of vacancies in personal health already. So trying to fill 3 more vacancies on top of what's in personal health will be a challenge. Felt like this was a win for us, a win for both of those divisions. So I did not seek additional positions with the Board of Commissioners when I presented to the Board of Commissioners. We agreed to the manager's recommended budget, which gave us those 6 positions. So that's good news for the agency. Communicable disease, it's rabies season again. in the past week and a half, 2 weeks, we've had 2 positive animals, different species from different locations. So just to remind you and remind our residents who may be watching the meeting tonight to not approach wild animals, to please contact animal control for assistance, and to please get your pets vaccinated for rabies if they're not vaccinated, or get their vaccines updated if they're not up to date. Not sure that this represents anything out of the ordinary. It's only my 2nd year in the job, so I don't have a good feel for how many rabid animals we see in a typical year. But we had these two events in the past couple of weeks. Environmental health, our new division director is settling in. Hard to believe she's been on the job for 2 months already, but Angie has jumped in with both feet and is doing a great job over there. She brought to my attention an old Board of Health ordinance on manufactured home parks. This clearly needs some reconsideration and some updating. It may be possible to abolish it and use the planning ordinance in its place. Ms. Manning and I are working on this with planning and with the county attorney's office, and we will come back to you with a presentation on this either next month or the month after, depending on how fast that work goes. But that needs at least some updating, and it may be possible to abolish it and just use what's in planning's ordinance. The fuel situation, I'm sure you've all heard about this. Fuel is available, but in limited supplies. We will likely feel the impact of this first in environmental health. Angie did get all of her vehicles gassed up today. We have some field work that needs to be done. We're going to allow that field work to continue with judicious use of fuel. And if a contractor or someone can't be there because they don't have fuel, we won't go out and look at that site if we need them on site to conserve fuel. The lack of fuel is likely going to compromise some of the services provided by the health department, and this situation is rapidly worsening. The news says the pipeline may be operational by the end of the week, but I don't know that anybody's got a good feel about this one yet, and it certainly feels like it's getting worse. WIC, some good news for you. In WIC, we have over 5,100 enrolled participants. This is partly due to the auto enrollment that's going on with the state. And we are at greater than 100% of our required caseload, which is fantastic. I think the last official percentage I saw was 115% of our required base caseload. So that's a good place for our WIC folks to be. Let's move on and talk about COVID. I'm going to start out with vaccinations tonight. As of midnight last night, 59 hours on 5/10 of 2021, 56,141 first doses of vaccine have been given in Pitt County. 52,336 individuals are fully vaccinated with one of the 3 vaccines. 31.1% of our population is considered partially vaccinated at this time. 29.0% of our population is considered fully vaccinated at this time. So that's good news. From an equity standpoint, this is using that 5/10 data as well. African Americans represent 28.5% of our population in Pitt County, 28.5% of those vaccinated in Pitt County. As a portion of our population, they represent 36.9% of our Pitt County population. So they are lagging by about 8.4%. We are making efforts to reach out to that community and to vaccinate African Americans, but there's an 8%, almost 8.5% lag with African Americans. On our Hispanic or Latinx community, 5.3% of those vaccinated have been of Hispanic or Latinx origin. They represent 6.5% of the Pitt County population, so they're lagging by 1.2% at this time. I would mention that whites are 60% of the population. They've received 60.8% of vaccines in the county, so they're less than 1% ahead of where they should be from an equity standpoint. So not bad. We could be doing better, but not bad. I thought this might be even worse when we first started giving vaccines, but we've definitely made inroads with our Hispanic and African American community members. Vaccines available from a number of providers in Pitt County. We have vaccine available pretty much every day of the week. Vidant has a vaccine clinic. I believe they're still running out of Med Direct over there. with their vaccine clinic. The convention center shut down earlier this month. ECU has vaccine available through the Student Health Service, and Dr. Shackelford is still doing some work with his mobile team. And then we have multiple pharmacies in the community that are providing vaccine to folks here. Excuse me. We definitely have seen a decreased demand for COVID-19 vaccine. This seemed to match up pretty well with where it became available to everyone. We continue to provide COVID-19 vaccinations at the health department. We're consolidating that into our regular clinic work. We do see walk-ins for COVID-19 vaccines. We may come to the point where we have to waste some vaccine. Even the state has said that that is okay. They're asking the feds for an additional statement on that, but they would rather see someone get vaccinated, even if we have to waste a few doses, than to defer vaccination for another time. Recently, we took to the streets in an effort to try to increase the uptake of COVID-19 vaccine. Our staff visited mobile home parks in the Belvoir area and vaccinated residents willing to be vaccinated. The next day, they set up a pop-up clinic at the Tropicana store. That was a Friday morning a couple of weeks ago. And we're able to vaccinate 20 people there in about 3 hours. So not bad. We do plan to go back and do boosters at these locations, and are looking to do other pop-up clinics on Thursdays and Fridays for the foreseeable future. Dr. Hardy and her team will be hosting 2 off-site COVID-19 vaccine clinics this week. We are doing another clinic at Cornerstone Missionary Baptist Church on Allen Road. That'll be on Thursday. We've had some good success there in the past. They've been a great partner for us. We did a flu clinic there. And we've now done, I think this will be our 3rd COVID-19 vaccine clinic there. We were also approached by Jarvis Memorial Church in Uptown Greenville to do a clinic, and we will do a clinic there on Friday at their facility. Both of these events will feature walk-up registration, so there's no appointments necessary. You just walk up, do the paperwork, and you can get your shot. Dr. Hardy and her team have also been working with local businesses to vaccinate their employees. We recently did the employees of a fast food chain here in the Greenville area through that program. So getting some uptake, but it's definitely slowed down. The Johnson & Johnson vaccine, as you probably have heard, is no longer paused. The blood clot rate reported with this was 0.87 per million doses given. For comparison, the risk of Guillain-Barré syndrome, or GBS, after influenza vaccine is reported at 1 to 2 cases per million doses on the CDC website, and the link is in my PowerPoint for you all if you do want to look that up. Pfizer, and folks, this is the kind of thing that drives me and other health directors crazy. The Pfizer change was in the news before we knew about it. But apparently late yesterday, the FDA changed the Pfizer emergency use authorization to allow the vaccination of individuals 12 years and older. Pfizer had been approved for 16 and older. We knew this was coming. We knew it was likely to happen by the end of the week, but it was in the press before it was actually told to us as public health officials. And I got to tell you, that's getting old. There will be a called meeting of the Advisory Committee on Immunization Practices, a committee that the CDC runs, to approve the use and indications of the vaccine in this new age group. We expect that those recommendations will be out by Thursday. Our practice is really based on the ACIP, or Advisory Committee on Immunization Practices guidelines. So from a public health standpoint, we would not begin administering this, and most clinicians would not begin administering this until those ACIP guidelines have been published regarding the new age group. In general, and this has been Dr. Tilson, the state health director's position on this as well. In general, children and adolescents should receive their vaccine in their medical homes. That means their doctor's office. We do know that some children do not have, or adolescents do not have a primary care provider. We are working to make arrangements for those children to get vaccinated, either through us, Vidant, or another third party. I did talk to one local pediatrician who felt that probably half of the kids in his practice in that age group would get the vaccine. I think that's kind of high, but I would be happy to see that if it does come to fruition. So that change has happened and is coming. And we anticipate that the 12-year-old, 12 to 15-year-old age group, which has not been active for vaccine in the past, will begin to get some vaccination here in the county. Take a quick look at our data. This is where we were last month at our Board of Health meeting. We had just come out of probably the lowest point in the pandemic since very early last year. We had 407 cases over the past 2 weeks. That was a rate of 29 cases a day. We were at about 2.2 cases per thousand, and we were just kind of starting to climb our spring wave. Total cases were 18,563, about 10% of the Pitt County population. Our estimated recovered were just over 18,000, representing about 97% of our cases. Our cumulative fatalities to that point were 86, and our case fatality rate was at 0.5. Proportion of tests returning positive was 5.2%. We went over the hump and did seem to be starting down a little bit towards the end of last week. We were down on Thursday, Friday, and then Monday. We had a little bit of a bump Tuesday, a little bit of a bump Wednesday, sort of leveled off. We are still down from where we were at the height of the spring wave, but higher than I would like to see it. 524 cases over the past 14 days. That's 37.4 cases per day. We're up to 2.8 cases per thousand residents. Much better than it was at the height of the pandemic in January, our January wave, but still higher than we'd like to see it. We were down at about 1.5 cases at the bottom of the curve. Over 19,000 residents in Pitt County have had this, 19,678, representing 10.6% of our Pitt County residents have been infected at some point with COVID that we have identified. And our estimated recovered of those folks are 19,067, or 96.8% of cases. So again, about 97% of our cases would be considered recovered at this time. We did add 1 fatality since last month to bring our total case fatality to 87. At this time, our case fatality rate does remain low at 0.4, unrounded at 0.44, and it has ranged from 0.4 to 0.7 throughout the pandemic. As you can see, our percentage of tests returning positive, and this is a 14-day rolling average, by the way. So over the last 14 days, we've averaged about 8% as our returning test positivity rate. So higher than we would like to see it. We're down in the 3s at one point, so I'd like to see us get back down there. I want to show you a couple of graphs. This is our epidemic curve for Pitt County, looking at congregate living versus non-congregate living. The blue is the non-congregate living. This orange or salmon color represents individuals in congregate living. This was our spike in the nursing home back in the spring last year. Remember when I thought that was a big spike? This was around the time of our ECU outbreak. This is the ECU spike. And you can see we had some activity in the nursing homes decline and had some through the fall. Vaccinations would have started in December. And by the end of January, COVID almost disappeared. We've had a scattered case or two in staff and or residents in the nursing homes. You can see after sort of the end of January, beginning of February, by the time people had gotten their second vaccinations in the nursing home, this has just disappeared from our long-term care facilities for the most part, which is great news, because these folks are certainly at the highest risk for severe COVID and even fatal COVID. So I think that's some good news to report this evening. This is again the epidemic curve, looking at it by age, and the reddish color here, this is the 25 to 49-year-old group. The 18 to 24-year-old group was generally the next biggest bar at any time, was the biggest bar during the ECU spike, obviously. And then 50 to 64 is bar number 3 in most of these. So young workers, older workers, college-age students, and then 0 to 17 are our preschool and school-age kids for the most part. And they've gone up a little bit here as we near the end of the school year. So the fire's really burning in this sort of the middle, 25 to 49, 50 to 64, and 18 to 24-year-old group. That's where we really need to apply the extinguishing agent, so to speak. The fire captain in me just refuses to let go. And then I'm going to let my deputy director talk to you very briefly about a campaign that we're going to be involved with on behalf of the state called bringing summer back. So I'm going to turn the floor over to Amy for a minute, and then if you all have questions, happy to take your questions.
Good evening, everyone. This is a new campaign that is being sponsored by NCDHHS. Pitt County is certainly not alone in the decrease in individuals seeking and receiving the COVID-19 vaccine. So the state is trying to make it easy on all the counties by branding a campaign that we can easily use their materials to tailor what works within our community. So there's 5 steps to it. The first is to register your organization, which Pitt County Health Department has been registered to participate in the campaign. We've sent them our logo. Hopefully it will soon appear on the Bringing Summer Back campaign website. Haven't seen it yet, but it should soon be on there. Step 2 is to download a toolkit. And that toolkit is full of branded materials such as flyers, posters, billboards, social media templates, and even talking points that they want us to all keep that looking the same brand across the state. And that is a good idea in marketing. We want people to see something over and over again until they finally get it. By the time we're tired of seeing it and think that everyone should get it or understand it or see it, they're just starting to get it. So and that is the whole idea of keeping that brand the same across the state. Then the third step is to build a campaign that's tailored to our community. The state does realize, in which they have said in some of our meetings about this campaign, they realize that not everything works the same way in every county. So they want us to take their materials and tailor it to work in Pitt County. I have requested some assistance from all of our staff across the agency to provide ideas of what they think may work in our county, and we welcome any other feedback from anyone that would like to be part of that. And then the fourth step is to execute the campaign. Some counties have actually started this week. The first week runs May 9th through the 15th. It runs through the end of May. And then we had registered Pitt County Health Department to participate 2 weeks in June 6th through the 12th and June 20th through the 26th. So that's when our area should start seeing these campaign materials. And then they're asking us to share all of our efforts with NCDHHS, but also through social media using their branded hashtag, which is hashtag Bringing Summer Back, so that all of the materials will be housed under that hashtag, and collectively across the state, we can see what everyone's doing to try to encourage individuals to get vaccinated. So we'll let you know at the next meeting how that's going. And actually it'll be in July before we know how it's going, since ours will launch June 6th through the 12th and then the 20th through the 26th. So not sure how effective the campaign will be, but we're certainly willing to try and hope that it will encourage more individuals to get vaccinated. And hopefully that our doors will be just like the gas lines are today. At the end of the campaign, people will line up to get the vaccine. And that's all I have for the campaign.
We hope so. We
hope so.
Yes. Does anyone have any questions for either Amy or Dr. Silvernail?
I have a question about that age group that seems that age group that Dr. Silvernail replied to, as far as being the one where the fire is burning the hottest. It's like, from what I see here at my office, they're not very, some have been vaccinated, but a lot of them are not necessarily rushing out to get vaccinated because they don't really feel like they are as much at risk. And so what would your response to that be, Dr. Silvernail? What are your thoughts on that?
I agree with you, Dr. Hayes. The perceived risk is what we battle with all the time in preventative health and public health. For that age group, most of them feel like COVID will be a trivial illness. So I don't think that they're as anxious to go out and get vaccinated. I did have one person reached out to me through a colleague at ECU about the 12 to 15-year-old age group already this morning, before I even knew that it had been approved by the FDA. So there's always some folks that are anxious, but in that group, it's I think the perceived risk that we struggle against. And then there's a number of misinformation stories circulating about the vaccine I think that has something to do with it. And I think that at this point, a lot of folks just have some COVID fatigue and are tired of hearing about COVID or COVID vaccine or anything to do with COVID. So,
Speaking of COVID fatigue, I think that our business, like many businesses, we shut our business off, and I know that many businesses are still closed to the public as far as their indoor facilities. And we did that because we did not want to risk bringing it into our hospital to our staff members. And now we're facing this dilemma about when do you change your policy? When do you change and open up again? And we're getting some pushback from clients already that are, they either say, well, we're vaccinated, like that means that's like the complete green light. I'm not sure what that means, honestly. What it means if you're vaccinated. It means you're protected, but I don't know that it necessarily means you can't carry the virus. And so I'm a little concerned about that. But then you go around Greenville and other areas, and there is a wide range of what you see in terms of how open businesses are and what they're doing. Or not doing, as the case may be. And so I've been sort of anxiously watching Florida, Texas, other states that are pretty much wide open to see if they are experiencing major problems. I haven't heard anything, and yet, is that the test? I mean, is that an indicator of maybe where this is going, do you think? Or how do you feel like we begin to make that transition back to where we are more of an open business environment?
wow. There's a lot packed in that question, Dr. Hayes. Different people have different levels of comfort. There are some folks who think COVID is a joke and have done nothing to protect themselves. And some of those same folks, by luck, as you say, hey, if 10% of our population has had it, that means 90% of our population hasn't. We think that there's probably more disease out there than we measured. But even if that was 20% of our population has had it, 80% of our population still hasn't. So, if 8 out of 10 people haven't had it, there's 8 out of 10 people who say, well, hey, I've done all this stuff and I've never gotten sick. I don't know anybody that's gotten sick. Although I think by now most of us have know somebody who's been sick with COVID, or maybe even died of COVID, somewheres here in the country. The reopening issue, I think there's some folks who would be happy to sit behind a computer screen for the rest of their lives. I kind of would rather, if I'm got to interact with people, then I think I'd rather do it face to face than virtually. Virtually is good sometimes, but a year and change into this, and some people still have significant technical difficulties. I think some things get lost in translation. Can you teach through Zoom? Sure. I find it as an instructor hard to read the room through Zoom, because I can't see all my students when I'm teaching. I'm not sure how we get back to normal. I think that's going to be a long and difficult road for people to get that sense of comfort back. I think the vaccine is part of that. And certainly I would encourage folks to continue to get the vaccine if they're not vaccinated. I think some people with the stories of, well, you're going to need a third shot now. I think that may have discouraged some folks. Well, you told me I needed 2. Now you're telling me I need 3. And some people say, oh, I might need this every year. I think the jury's still out on those things, but I do think that is working against us in some respects. I think the J&J setback has worked against us in terms of vaccine uptake. I had high hopes for the J&J in terms of that seat of the fire, that young, healthy working age group. I thought that'd be a great place to get this, because we could hit a McDonald's, a Burger King, whatever, do their staff one day, we're done. If we went out to a factory, we could do the factory in one day and be done, or a couple of days and be done, and not have to plan a return trip. When you look at that rate of complications, very rare complication, only occurred in women, so far as we know of reproductive years, and 0.87 per million doses given. And Guillain-Barré with flu vaccine is 1 to 2 per million doses given. Most of us wouldn't think twice about getting the flu shot, but we've got some pause with the J&J because of the newness of the vaccine. So it's kind of a rambling answer. I don't know if that hit what you were looking for. And
I'm not sure there is an answer. I was just looking for your thoughts on the subject. We're wrestling with trying to figure it out. And the truth is there is no 100% correct answer. And I think that's the challenge for all of us in our personal lives and businesses to decide, how do we behave moving forward? And as someone who goes down to Washington, North Carolina a lot, let me tell you, they are wide open. I mean, the fatigue is evident down there. Masking is significantly less than in Pitt County. And it is a concern to me personally when I go out, just because I feel like that is, I don't want to say inconsiderate, but maybe it's just not being, practicing safe habits. And so I don't know. It's like, I just question what is the path forward. And so I just thought I'd get your thoughts on that.
Yeah, we struggle with that too. And we've had some of those conversations at the health department. When do we return to normal clinic schedules? When do we stop screening folks at the front door? When do we re-engage in some of our outreach activities or our group class activities that we've had? Our centering program, the sort of the group maternity visit was gaining popularity, especially with our Hispanic ladies. And we had to put that on hold because of COVID. We bring it back together. Part of me is like, this would be wonderful to bring it back. But then if we have that case that comes in and now we infect a whole bunch of pregnant women at one of our centering meetings or visits, there's going to be no explaining our way out of that. It's something that, at some point you wouldn't not take a walk in the woods because there are rattlesnakes in eastern North Carolina. At some point, I guess we have to think of COVID as part of the environment, and that there's a risk of being exposed, and you do what you can to limit your risk, but you go on with life.
Thank you.
You're welcome, sir.
I don't know. I wish there was an answer, but it's just difficult. It's so difficult.
Me too.
Yes. Does anyone have any additional questions for Dr. Silvernail or Amy? Okay. Thank you so much for that update, and Amy, for telling us about the new campaign. So hopefully it will work too, and we'll have lots of good activity, and we'll be able to get back to whatever the new normal is soon, for everyone's sake. Are there any further announcements or business for the good of the group? Okay. There being none, might we have a motion to adjourn?
So moved.
Second.
Thank you. And thank you everyone for joining us this evening.
All right.
Thank you.
All right. Thank you. Have a good
Thank you, folks. Good night.